All right, today we're going to talk about a piece of medical tech that could seriously change the game for healing after surgery. We're jumping into a fascinating study out of Singapore that put a new weapon to the test, a weapon against one of the most common and dangerous complications a patient can face. So let's get right into it.
So let me ask you something. When you picture a major operation, what's the first risk that pops into your head? Is it something dramatic happening in the operating room? Maybe the anesthesia?
Well, it turns out one of the most persistent dangers actually shows up after everything has been stitched up, when the healing is supposed to begin.
And that brings us to the heart of the problem, a complication that's a thorn in the side of doctors and patients everywhere. We're talking about surgical site infections, or SSIs, and they're a huge deal. They're a massive burden on healthcare systems, they increase how long people stay in the hospital, and tragically, they can be incredibly dangerous for the patient. It's an infection that gets a foothold right at the spot that's most vulnerable.
And here's the thing, not all surgeries carry the same risk. For some of the most complex procedures you can imagine, like major operations on the liver, pancreas, and bile ducts, that's what we call hepatopancreatobiliary surgery. The risk of infection just skyrockets. This research points to an SSI rate between 20 and a whopping 40%. Think about that. That's a 1 in 5 or even close to a 1 in 2 chance of getting an infection. That's just way too high.
So with a risk that high, you can bet researchers are looking for any kind of advantage, which leads us to a really cool idea. What if you could just vacuum seal the wound shut? And that's basically what this is. It's called the Prevena Incision Management System. The science behind it is a bit of a mouthful. Closed incision negative pressure therapy. But the concept is simple. Instead of a normal bandage, this system applies a gentle but continuous suction right over the incision. Let's take a look at how it works. Okay, so here's how they do it. First, the surgeon closes the incision with staples, which is pretty standard. Then they place a special foam dressing right on top. Step 3, a clear adhesive sheet goes over the whole thing, creating a perfect airtight seal. And finally, they hook it up to a little machine that applies that constant, gentle vacuum pressure. So what is all this suction actually doing? Well, it's pretty brilliant actually. It's doing 4 key jobs at once. For one, it physically helps hold the edges of the wound together. It also actively pulls away any extra fluid that might build up and become a breeding ground for bacteria. Third, it helps boost blood flow to the area, which is absolutely critical for healing. And finally, that seal acts like a shield, blocking any germs from the outside world from getting in.
It all sounds great on paper, right? But the million-dollar question is, does it actually work in a real hospital with real patients? Well, that's exactly what this team in Singapore wanted to find out.
So here's the study at a glance. It was a retrospective cohort study, which basically means they went back and looked at the records of 70 patients who had all had these really complex abdominal surgeries. 10 of those patients got the Prevena vacuum system, and the other 60 got the standard wound dressing. And the main thing they were looking for was simple. Who got an infection within 30 days of their surgery?
So, after they crunched all the data from those 70 patients, what did the numbers actually have to say?
The difference was just wow. It was stark. In the group with the standard dressing, more than a quarter of them got a superficial infection. And more seriously, 2% got a deep infection. And a shocking 17% developed an organ space infection. That's the worst kind you can get. Now, look at the Prevena group. Okay, one patient got a superficial infection. But for the really bad ones, the deep and organ space infections, the rate was 0. Absolutely 0. That's a number you love to see in medicine.
The researchers were able to boil this whole finding down into one incredibly powerful number, 0.03.
So what does that number mean? That's the odds ratio. It means that even when they accounted for other things, the patients with the Prevena system had dramatically, significantly lower odds of getting an infection. And that little p-value there? That just confirms this wasn't some random fluke. It's a real, statistically significant finding.
But the study didn't stop there. It also uncovered another huge risk factor, and it came with its own pretty big number, 7.63.
This number is all about time. The analysis showed that if a surgery lasted more than 8 hours, the patient's risk of getting an infection shot up by over 7.5 times. This makes a preventative tool like Prevena even more important for those marathon procedures, where we now know the risk is already through the roof.
But believe it or not, the benefits didn't just stop with preventing infections. When they dug into the data, they found a much wider range of good news.
For starters, the Prevena group, on average, went home sooner, 11 days compared to 14. They also had nearly half the rate of what's called wound dehiscence. That's when the incision actually starts to come apart. And remember how the device sucks out fluid? Well, that probably explains why there were 0 cases of seroma or hematoma, which are nasty fluid collections under the skin. You add all that up, and you're not just looking at better healing, you're looking at potentially lower costs for everyone.
Now, it is super important to look at this with a critical eye, and the researchers themselves were very clear about this. The study had some real limitations. It was retrospective, remember, so they were looking at old data. The sample size was pretty small, especially that Prevena group with only 10 patients. And there was no blinding, meaning the doctors knew who got which dressing, and that can sometimes introduce bias.
And really, the authors of the study put it perfectly themselves. They said this study could be used as a stepping stone. They're not claiming it's the final answer. They're saying, hey, we found something really promising here, and this should pave the way for bigger, better studies in the future.
So what's the big takeaway here? Well, even with its limitations, this study gives us some really compelling early evidence. It suggests that a sealed, vacuum-assisted dressing could make a massive difference in preventing the most severe infections after some of the most difficult surgeries we perform. Which really leaves us with one big question. Are we looking at the future of how we heal,